I chose the topic COPD today for a couple of reasons. COPD stands for C for chronic, O for obstructive, P for pulmonary, and D for diseases. Okay? So as we can tell just by looking at the breakdown of the letters, that it is not one single. So as we know that it's broken down into chronic, obstructive, pulmonary diseases. So it's a combination of three disease processes that falls under this umbrella. I'll try to make it as easy and as interesting so everybody can relate to it and understand the importance of this syndrome or disease process. So COPD, if we talk about it, the reason why I chose it was recently a survey and different studies showed that COPD has replaced cerebrovascular accidents like strokes and deaths from CVAs and cerebrovascular accidents to become number 3 leading cause of death in this country. Can anybody name the first two? Can't hear you. Okay. Very good. Okay. So heart attack or coronary artery disease and lung cancer, and now COPD follows. Okay. So the COPD has become the 3rd largest cause of people dying in this country. So I feel privileged to be a pulmonologist because 2 of the top 3 leading causes of death fall under my category, pulmonology, lung cancer and COPD, which are kind of related to each other. A lot of emphasis has been placed on cardiovascular health, healthy eating, diet, active lifestyle, and lowering cholesterol, and all that good stuff. But this disease has been creeping up on us under the radar. This is the most underdiagnosed and undertreated disease in this country. Okay. So what exactly is COPD? As we said, that it's a collection of 3 diseases. Number 1 is emphysema. A lot of people know kind of partly what that is. Chronic asthma. A lot of people know what that is. And chronic bronchitis. Almost everybody knows what that is, but not really, including the physicians, okay? Anytime somebody comes in with a cough and phlegm, they get diagnosed with chronic bronchitis, which is not the way it should be, okay? We know emphysema. Emphysema is a disease in which the lung structure gets destroyed, mostly by smoking, but there are other things that can do that. And we know chronic asthma persisting for years, starting in the childhood, going away, then come back. And chronic bronchitis, if anybody has productive cough for more than 3 weeks, 3 months in a row, that's the diagnosis of chronic bronchitis. Okay? So productive cough, lasting more than 3 weeks, and symptoms coming back for almost 3 months, that's chronic bronchitis. Now, how do we, let's talk about the damage that happens in COPD. COPD affects lung, as we know, chronic obstructive pulmonary disease. So the lungs are affected the most. There is a damage to the inner lining of the lung and the airways. Airways started secreting more mucus. They become thickened, so we use the word remodeling. And normally the airways, the way that I describe a lung in a very, very simple analogy is hold this tree in Lufkin. Huge tree, big trunk, lots of leaves, big shady tree. Turn it upside down. That's how lungs are, okay? The trunk of the tree is basically the airway, the trachea, right? And then you have bigger branches coming out of the tree, right, closer to the trunk. That's your major airways going to both lungs. And as those branches branches further, going towards the periphery of the tree, you notice the branches become smaller and smaller and smaller, right? That's how a tree works. Exactly, that's how lungs are. Bigger airways at the top, and then airways getting smaller and smaller and smaller and smaller. So the analogy I use is the branches of the tree are the airways in which the air travels when you take a deep breath in, and the lung tissue itself, I compare it to the leaves of the tree. Okay, so there are two things, airway and the lung tissue itself, branches and leaves. Branches, what does branches do in a tree? They carry the water and the mineral from the soil all the way up to where? Leaves. Leaves are the factories, or the main working unit of the tree, where photosynthesis happens and oxygen and carbon dioxide gets replaced. Same thing in the lungs. The airway transport the oxygen through the main airways onto the lung, into the lung tissue, where the change of oxygen and carbon dioxide happens. So I don't know which came first, lungs or the trees. I don't know. But somebody cheated somewhere, okay? They should be copyrighted. So that's how the lung is designed. In COPD, it affects both the branches and the leaves. So COPD affects the airways. So the airways normally should be good conducting channels, open wide, the air should go in and come out. No, it becomes thickened. It starts secreting more mucus and destructive cells that remodels the airway in a way that the airflow is limited. Hence the term obstruction. Obstructive airway disease, see, the airway is obstructed now because it's thickened, the lumen is narrow, the air is finding hard to go through it. And not only that, the leaves get destroyed too. And so the normal mechanism of getting rid of carbon dioxide from our body into the air and putting oxygen into our bloodstream gets hampered. So the oxygen drops in the body, okay, and carbon dioxide goes up, which is exactly the opposite of what our body needs. What causes COPD? Traditionally, it was supposed to be male's disease. Male, over 50, COPD, not a big deal. You'll be surprised. That's why it's important that I'm talking about this today. Since 1980 to 2000, women have overtaken the men. Power women! Okay? 30% increase in COPD from 1980 to 2000. The other numbers are still coming up. 30% increase. Women suffer from COPD more than men in this country. So it's no longer a guy's disease. Okay? So it's very important to know what the disease is, what the symptoms are, when to get help, and how to get treated. So we talked about a little bit of the pathology of what happens. Now we're going to talk about what causes it. Okay, 80% cigarette smoking. No ifs and buts about it. But it is not as simple as that. Okay, a lot of people have quit smoking now. Why is the COPD prevalence still rising? So there are more to it. Okay, so environmental factors. Okay, now we live in a very, very clean society, so clean that it sucks. Okay, we are secreting chemicals from our labs, from our factories, that are not detectable by the machines that were designed to detect those chemicals 30 years ago. Okay, so we are producing chemicals that we don't even know how to check for them. What is the impact of those chemicals on our lungs? We'll find out in the next 50 years. Okay? But what we are finding out right now is the effect of what happened 50 years ago. Okay? And same thing with smoking. Okay? Smokers are coming up with more fancier cigarettes. Okay? And previously the cigarette was just rolled up. Remember you used to roll that thingy? Peanut paper and okay. And how you used to smoke it, like this or this? Or like this? Okay. So that used to be a simple cigarette at that time. Now what they have done is they have added more chemicals into the cigarette so that you don't cough when you smoke. Okay? Because smoke is an irritant and lungs are designed when you cough, when you take that irritant in, you're supposed to cough. Body telling you, it shouldn't be in where it is. So they started adding anesthetics to the cigarette and tobacco, so that when you're inhaling it, you don't feel anything. They have made the particle size of the smoke even smaller, so that it goes more deeper into the lung. So previously, we were having lung cancers in the upper airways. Now we're having cancers further downstream. So things have changed. Okay, things have evolved, both on the good side of the law and the bad side of the law. You know, when the crooks get smarter, the police catches up, and then crooks get more smarter. You know, so we are producing these chemicals from these factories, making more fancy cigarettes, and the damage is continuously going on. So, cigarette smoking, 80% cause of COPD. But environmental factors, as we talked about, and genetic factors. Okay? How many of you have heard of a disease called alpha-1 antitrypsin deficiency? Probably nobody. Okay. Alpha-1 antitrypsin is an enzyme in our lungs that protects our lungs. Some people are genetically deficient, or there's a total absence of that enzyme. Okay? So if the lung gets exposed to any harmful chemical, and there is less alpha-1 antitrypsin, so what's going to happen? The lungs are going to suffer more. Okay? So you have less of a protecting effect from that enzyme. So genetically, in our clinic, Lisa knows about it. You know, when people come in and they're a smoker, but I see that their damage to the lung is out of proportion to their age, to their smoking exposure, to anything else. It just doesn't make sense. All we do is we ask them to give us a drop of blood, and Lisa is very good at that. It doesn't hurt. At least that's what she tells me. And then we collect that blood and we send it out to Washington, out of the state. It's all free of cost. And they test that for genetic factors and to see if a patient has alpha-1 antitrypsin deficiency, or if they're career. So we also do genetic screening so that we can test other family members or the possibility of having a child with that disorder. So it's a very, very simple test. And once we find out, we replace alpha-1 antitrypsin, which is available in synthetic form, and we reverse the lung damage. So that's one of the treatable causes of COPD. COPD is not curable. Tell me one disease which is. Probably none, okay? We really don't know. We don't know how disease process starts and if it really ever ends, okay? COPD is an irreversible disease. Damage to the lung is done. It's going to stay that way. But why do we worry about it? We worry about it because we can control the damage. We can slow down the deterioration. We can treat the symptoms, improve the quality of life, and I mean that's a big gain. Okay, and our advancement in medications in treating COPD has gone a long way, which we're going to talk about in a little bit. So, so we talked about what is COPD. We talked about how it affects the lungs. We talked about who suffers the most, and we talked about what causes COPD. Now, how do you know if you have COPD? You won't. Nobody does. Okay? But there are certain symptoms that you can look for that might point towards something in the lines of COPD. Shortness of breath, or the term that we call dyspnea. Okay, it's spelled as dyspnea. I don't know why Greek do that all the time, but it's dyspnea. So dyspnea is a perception of being short of breath. Okay, it's a perception. So it varies from person to person. What is shortness of breath to you may not be the same for her. Okay, and also the amount of activity that causes that perception of shortness of breath can vary from one person to another. What that depends upon is how active one is in their everyday life, what is their lung condition, what were the exposures, and how much of a whiner they are. Okay? So if I have pain in my hip, I probably have hip cancer. That's the kind of guy I am. So I'm a big whiner. Anyways. And interestingly, the cause is not known. Women complain more when they suffer from COPD and shortness of breath. Same level of disease process in a 50-year-old guy and a 50-year-old female. The female will have more shortness of breath. Why? We don't know. Maybe you guys do. I don't know. But they will complain more than they have more perception of shortness of breath. Now, is shortness of breath, the question one might ask themselves, is the shortness of breath only when I run at 8.5 on a treadmill for 45 minutes? Yana, right? So you get short of breath, it's normal, right? Or when you're doing Zumba for 3 hours, for God's sake. Okay, so you get short of breath, that's normal. Okay? But if you walk 100 feet on a level ground on a good day, not out like it was a few days ago or yesterday, and you feel like you can't catch your breath, there is a problem. Okay? Or sudden change, like you were able to carry a load of laundry upstairs, now you have to stop in the middle to catch your breath. Okay? It was okay for you to walk outside to get your mail, now you make your husband do that. Okay? And you look for the ads on TV for hover around. Okay. So just like they say, you might be a redneck, you may have COPD. Okay. Okay. So when that happens, now shortness of breath can come from so many reasons. Lungs just get blamed for everything. Okay, if I'm short of breath, well, probably it's my lungs, because we breathe through our lungs. But no, lungs can simply be just responding to what else is going on in the body. If somebody's having a heart attack, they'll be short of breath, I'll tell you that. Okay? If somebody's having an anxiety attack, they'll be short of breath. And a lot of you can relate to that. But, so when do we know it's lungs and it's not anything else? That's where we come in. Okay? That's where it's important to get medical help and find out if it is really my lungs or is it something else going on. We do simple testing. Again, I'm going to talk about my Donna and Lisa. You know, when I come in and I said, okay, well, let's do a 6-minute walk. Simple test. So what Lisa does is she picks up a pulse ox monitor, puts on the finger of the patient. She said, let's go for a walk. And she takes the patient, walking the hallway at a little faster speed, and keeping an eye on the monitor, seeing what's happening to the oxygen, what's happening to the heart rate. If somebody has a lung problem, okay, their oxygen saturation will drop. Normally it runs over 90, 95, 100. In a normal person, the oxygen saturations go up when you try to work out. Okay? So if you have a lung problem, it will drop. If somebody is short of breath, and they are short of breath because of a heart condition, because the heart cannot pump the amount of blood that's needed to be pumped when they are physically active, their oxygen saturation will not drop. Okay? It will either stay the same or go up. But the heart rate will be through the roof. Okay? Or the blood pressure will drop. So simple things like that can tell us that shortness of breath is either coming because somebody is having a heart problem or is it purely a lung issue. But in real life, it's never one thing. Okay? Usually people who have lung problems have some sort of heart problem or blood pressure problem because everything works in synergy in our body. They're closely tied together. A chronic lung problem can lead to a chronic heart problem, and chronic heart problem can do the same to the lungs. Okay? So we do simple testing. Still, I would say COPD is the simplest disease to diagnose. Simplest disease to diagnose. And very easily preventable and treatable. And it's unfortunate that the prevalence of this disease is going up and more people are dying from it because people are not aware of what exactly, they know what, they've heard about COPD, but they don't exactly know what causes it, how it starts, and how easily it's treatable. Okay, so there's another test that we do, and that is done in a hospital, but it's still a very simple test. It's a little blowing maneuvers that we do. We call it pulmonary function testing, or spirometry. Okay? And we give you a tube to blow in. The tube is connected to a little computer that senses how much air is coming in, at what pressure, and we calculate the lung functions. Lung volumes, lung capacities, oxygen exchange, and all the good stuff. Information that I need to know to see where you stand with your lungs. Then we order a simple chest x-ray. So, you know, we're not talking about heart caths, we're not talking about invasive brain surgeries, we're talking about simple 6-minute walk that Lisa does, and then a simple spirometry that the hospital tech does, and boom, we have the diagnosis. Okay? How simple can it be? And so once we have the diagnosis, then we stratify the risks. Okay? If somebody is a smoker, it's about time to quit then. Okay? If somebody's husband is a smoker, it's about time to get a divorce. No, I did not say that. God. Just don't take all of my advice, okay? Just a few. Okay. And then of course comes see Dr. Siddiqui, okay? And there are good treatments available, okay? Simple treatment, if the disease is mild, and we have certain scales that we calculate on mild, moderate, and severe COPD. So we, depending upon which stage is it, after we have stratified the risk and lifestyle modifications, we put them on some inhalers. Again, easiest of treatments. Okay, we're not talking about taking 20 pills and monitoring your blood glucose levels and coumadin levels and all that. Just take a puffer. Does it take a rocket science to puff air into your mouth? No, okay? And still people won't do it because they don't know how to use it or they don't know when to use it. So I sit down with the patients and I explain to them, this is how it works, and this is when you need to use it. And you'll be all right, trust me. Okay? Sometimes I wear the t-shirt that says, trust me, I'm a doctor. That helps. All right, so they're inhalers, and sometimes we have to add steroids. Now, if the disease is very severe, we have to put the patient on oxygen. Okay? Now, how many of you in this room, answer this honestly, think oxygen is addicting? It's like if I put you on oxygen, you may get addicted to it, right? All right, exactly. Make an appointment, Lisa, for that lady over there. Okay. Stay away. Okay. So it's the biggest myth that I don't know how many times I deal with in my clinical practice. Ma'am or sir, you need to be on oxygen. Anytime you exert yourself or you sleep, you need to be on oxygen. Okay. All right. So we got the whole setup worked done. The DME company comes in, arrange for the home oxygen. Next time, 2 weeks later, they're in my office, and sitting in the chair, huffing and puffing, and no oxygen. Okay, ma'am, where is your oxygen? Oh, it's at home. Or, oh, it's sitting in the car. Really? So your home and your car needs oxygen more than you do? I don't know. I don't feel like using it. I may get addicted to it. That's what my neighbor lady told me. And she's very smart. She cuts her own vegetables. So I trust her. She walks my dog too. So she said, no, oxygen is addicting. You get addicted to it and you will never be able to come off of it. And I take a deep breath and I sit back and say, ma'am, can I tell you an honest truth? I have been an addict since the day I left my mom's uterus. Okay? When I took my first breath of air, I was hooked on oxygen. And damn it, I have tried rehab. I have stopped breathing until I turned blue. Nothing works. So, I'm an addict. I'm so glad you're not. Okay, and I don't want to make one out of you. So anyways, joking aside, then I go into the detail as, okay, why is it so important for you to use oxygen? Okay, every cell in our body is dependent on oxygen. It's just like running a car without gas. Okay, you can't do it. Every cell is dependent on oxygen. Now, everybody needs oxygen with every breath we take, but some need it more if their lungs are damaged to a point where they cannot normally exchange gases. So we just need to give them a little supplement. Like if you're diabetic, you get some extra insulin. Okay? So it's simple. It's supplement. You have low thyroid, you get some supplemental thyroid. So what's the difference? Oxygen is a drug. It's given as a drug. It's prescribed. Okay? So, but anyway, so that's the biggest myth that I just wanted to joke about, and how many people think it's addictive. So sometimes, and then if it is even worse than that, even the oxygen is not working, all the inhalers are not working, then sometimes we recommend physical therapy, which is very, very good. Now, mind it, physical therapy does not improve lung functions. Why? Let me explain it to you. From the day one person is born till age 30, the lung functions increase. Okay, every day till age 30. After that, lung function starts to decline. Smoker, non-smoker, whatever. After 30, everybody start to lose lung functions. Okay? But the rate is different. If somebody is a smoker, their rate of decline will be much steeper. Okay? They may have a lung of a 60-year-old at 40 because of that steep decline. So when somebody stops smoking, okay, their lung functions do not go back to a non-smoker, okay? But it takes a new line in between the two lungs, and they still add another 10, 15 years to their lungs. It's very, very important. So physical therapy increases muscle mass. Physical therapy increases muscle tone. So what that does, it makes muscles more efficient in living with lower levels of oxygen, okay? So what you're doing is improving the other side of the spectrum. So either, just like the fuel prices are so high, either you can continue to drill, baby drill, and get more oil, or you can produce more oil-efficient, fuel-efficient cars, right? Simple? Love my analogy? Okay. So by improving muscle functions, making them more efficient in using whatever oxygen is being delivered to them, it gives them a patient feeling of well-being. They are not as short of breath, even though their lung functions haven't improved. Okay? So, drugs, lifestyle changes, oxygen therapy, physical therapy, all these things help. But it's very important to know that COPD still remains the third largest cause of death in this country, with the prevalence still on the rise. With that, I will end my lecture.